Tobagonians are being urged to get tested for COVID-19 if they experience any flu-like symptoms. The call from health officials comes just days after the recently concluded Tobago House of Assembly elections. Epidemiologist Dr. Avery Hinds says there is the potential to see an increase in cases on the island in the next few weeks, noting that not all protocols were adhered to. Sunil Lalla reports.
Just last week, County Medical Officer of Health for Tobago Dr. Tiffany Hoyt expressed concern over the lack of adherence to COVID-19 regulations on the campaign trail. In the lead-up to the THA elections, supporters of political parties were seen flouting regulations during motorcades. This was also seen at political rallies, where the parties were forced to stop entertainment at the end of their meetings, since it led to a carnival-like atmosphere. Director of Epidemiology Dr. Avery Hinds noted that Tobago currently has low levels of COVID-19, but warned that this could change soon. He said key to stopping a large increase in cases is testing and isolating those who present with the virus.
The first group of people who become ill, if they present, if they identify contacts, if they isolate, then we can actually take proactive steps to blunt any increase, and that's probably the most important message. If, as the weeks go by, we are starting to see more cases of flu-like illness, we do want to ensure that people are encouraged to come forward for testing so that the appropriate contact tracing and isolation can be done.
Dr. Hinds assured that the Ministry of Health is in constant contact with officials in Tobago.
We echo Dr. Hoyt's concerns in terms of monitoring, the ongoing monitoring of the population to see how any gatherings that would have taken place over the past couple of weeks would reflect in changes in the cases going forward. So we do have that surveillance that is ongoing. The ministry collaborates with the CMOH office in Tobago to look at the changes in number of cases.
He warned citizens not to let their guard down, as the weekly rolling average of COVID-19 cases have been trending downwards, following an increase in the early part of January.
We don't want the population to come away with the impression or the perception that it's only in these places that we're seeing COVID and therefore everyone else is free to do as before.
County Medical Officer of Health in Tobago, Dr. Tiffany Hoyt, has said that Tobago's healthcare system is prepared for any eventuality of an increase in cases. Sunil Lalla, TTT News.
A local COVID-19 consultant is warning the younger population that they can experience long COVID if they are infected by the virus. Long COVID refers to signs and symptoms that can occur following COVID-19 infection that persist for more than 4 weeks and cannot be explained by other medical conditions. Dr. Sana Mohammed says the common perception is that COVID-19 is an old people disease and infected individuals can have a full recovery, be admitted to hospital, or die. But patients can have long-term symptoms, such as what was experienced for Zika and chikungunya, and warns that young people are also susceptible, according to a study of over 4,000 people in 3 countries.
Increasing age and the elderly population were certainly more at risk of long COVID. But if we look at the 18 to 49-year-olds, the young patients, there is still a significant amount of patients, about 10%, who experience long COVID.
Dr. Mohammed adds that although long COVID is not contagious, people should remain cautious.
Unless you have reinfection, long COVID should not be contagious. But what's important for us to realize is that COVID is contagious and reinfection is certainly possible and has occurred before. So it's very, very important that even though long COVID is not contagious, those persons experiencing long COVID symptoms should still go on to adhere to the public health guidelines.
The COVID-19 consultant notes that there are currently 2 centers within the North Central Regional Health Authority that have been conceptualized to look after patients with long COVID. She believes, though, that a large number of patients will experience complications from COVID-19 for years to come, and that may have a significant impact on the local healthcare system.